This lecture is on Human Anatomy and Physiology, Chapter 1, the Human Body and Orientation. By listening to this lecture, it will help you with Chapter 1 on your first homework worksheet, and it will also help you study for your exam. So let's get started. Let's start with an overview of anatomy and physiology. The definition of anatomy is that it is the study of structure. There are several subdivisions of anatomy. Gross or macroscopic anatomy, which includes regional anatomy, surface anatomy, and systemic anatomy. Microscopic anatomy, which includes cytology, the study of cells, and histology, the study of tissues. It also includes developmental anatomy, such as the study of the developing embryo or embryology. There are several essential tools for the study of anatomy. One must master anatomical terminology, which is the language used to describe regions of the body. Observation of the body, being able to manipulate the body, like in physical therapy. Palpation, which means to touch. Auscultation, which means to listen. Physiology is the study of function at many levels. The subdivisions are based on organ systems. For example, renal, which is kidney, or cardiovascular physiology for the heart and blood vessels. The essential tools for the study of physiology include the ability to focus at many levels, all the way from the systemic to the cellular and molecular. Knowing basic physical principles, like electric currents, pressure, such as found in the blood, and movement of joints and muscles, and also basic chemical principles. Essentially, physiology is going to follow the principles of physics and chemistry. However, anatomy and physiology are inseparable, and this is known as the principle of complementarity. Function always reflects structure. What a structure can do depends on its specific form. Let's look at the levels of structural organization. In the chemical level of structural organization, atoms and molecules are studied. In the cellular level of structural organization, cells along with their organelles are studied. In the tissue level of organization, groups of similar cells are studied. And then the organ will contain two or more types of tissues, and an organ system will contain organs that work closely together, and the organism includes all of the organ systems within the body. This illustration shows the structural organization of the human body. In the first level, the chemical level, we see that atoms, which are the smallest units of matter that we study, combine to form molecules. Molecules are composed of different kinds of atoms, such as oxygen, carbon, hydrogen, and nitrogen. Many common molecules in our bodies include proteins, lipids, carbohydrates, and nucleic acids. In the second level, the cellular level, we have cells, and the cells are made up of molecules. The cells contain proteins, carbohydrates, lipids, and nucleic acids, and the organelles mentioned before help the cells do their work. For instance, the organelle pictured in this slide is the mitochondria, and it helps to provide energy to power the motion of the smooth muscle cell. The smooth muscle cell cannot work alone, And so in number 3, the tissue level, many smooth muscle cells join together to form a tissue, particularly smooth muscle tissue. The function of smooth muscle tissue is movement. Proteins inside of these cells are able to contract, and that will move substances through particular organs. In this case, the organ is going to be a blood vessel. And so in number 4, the organ level contains many different types of tissues. By definition, there will be at least 2 tissues in an organ. Most of the time, there are more than 2. The blood vessel contains an interior lining of epithelial tissue. It contains a core of smooth muscle tissue to move blood through it, and then an outer wall of connective tissue which supports and binds this blood vessel. Blood vessels don't work alone. So in number 5, the organ system level, we see that organ systems consist of different organs that work closely together. So the cardiovascular system, shown in this picture, includes the heart, which is the central pump that pumps blood into the red vessels here and carries them throughout the body. And then once the blood travels through the body, it comes back via the blue vessels into the heart so that it can then be recirculated. And there is an interim not shown here in the respiratory system where the deoxygenated blood will pump into the lungs to be reoxygenated before the heart pumps it back into the body for recirculation. And so the respiratory and cardiovascular systems work together, and that leads to number 6, the organism level. This is the level where all organ systems come together to make a functioning organism, and in this case, a human being. Let's look at the 11 organ systems found in the human body. The first system mentioned is the integumentary system. This is composed of the hair, skin, and nails, and within the skin, there is also a series of exocrine glands that will secrete sweat and oil. So the integumentary system forms the external body covering. It protects deeper tissues from injury. It synthesizes vitamin D. It is the main organ for touch, which is called cutaneous sensation. And it produces sweat and oil via the glands. Hair serves for identification and also helps to protect against abrasion, insects, UV radiation, and nails mainly function as tools. The skeletal system is comprised of the bones and the joints, and it protects and supports body organs, providing a framework that the muscles use for movement. Also, blood cells are formed within the bone marrow, and the bones themselves store important minerals such as calcium and phosphate. The muscular system allows for manipulation of the environment. Generally, when we talk about the muscular system, we talk about it in terms of the skeletal muscles. You will learn that there are 3 kinds of muscle tissue, but the skeletal muscles make up the muscular system because it supports the movement of the skeleton. Again, allowing for manipulation of the environment, as well as locomotion, which is moving through space and time, and our facial expressions. Other functions include maintaining body posture and producing heat. The nervous system consists of the brain, spinal cord, and the nerves, and it is a very fast-acting system. And the brain will send signals down the spinal cord into the nerves, And the nerves will send signals from receptors up to the spinal cord and to the brain. And so it responds to both internal and external changes in the body by activating the appropriate muscles and glands as a response. The endocrine system consists of 9 glands that aren't physically connected to one another, but that's okay because the function of the endocrine system is to secrete hormones. And hormones circulate throughout the body via the cardiovascular system. Hormones are chemicals that regulate processes such as growth, reproduction, and metabolism, or the use of nutrients, by our body cells. They include the pineal gland, pituitary gland, thyroid gland, thymus, adrenal gland, pancreas, and the reproductive glands, ovaries, and testes. The cardiovascular system consists of the heart and the blood vessels. Blood vessels will transport blood, which carries oxygen, carbon dioxide, nutrients, and wastes throughout the body. The heart is what pumps the blood, and you'll learn that there are 2 circuits that are contained within the human body. The systemic circuit, which goes to the head, shoulders, upper limbs, and then the trunk and lower limbs, and then the pulmonary circuit, which goes to the lungs. The lymphatic system is also known as the immune system. The lymphatic system consists of lymphatic vessels that follow alongside the cardiovascular system and help to control the distribution of tissue fluid. So the lymphatic system will pick up fluid leaked from blood vessels and return it into the blood. This helps to regulate tissue fluid homeostasis and prevent swelling. The lymphatic system also disposes of debris, and this includes bacteria, dead and dying cells. It houses the white blood cells called lymphocytes that are involved in the immune system response. The immune system response will mount an attack against any foreign substances within the body and helps to protect us against disease and pathogens. So organs of the lymphatic system include not only the lymphatic vessels, but also the thymus, bone marrow, and the spleen. The respiratory system consists of the respiratory tract, including the nasal cavity, the pharynx or throat, the larynx, which includes the voice box, the trachea, which divides into the 2 bronchi, reaching down into the lungs. The respiratory system keeps blood constantly supplied with oxygen and removes carbon dioxide. The gaseous exchanges that occur through the walls of the air sacs of the lungs occur in the alveoli. The digestive system includes the GI tract, which consists of the oral cavity leading to the esophagus, and then the stomach, small intestine, large intestine, rectum, and anus. The digestive system breaks down food into absorbable units that enter the blood for distribution to the body cells. Indigestible foodstuffs are eliminated as feces. The urinary system consists of the kidneys, ureters, which carry the urine filtrate to the bladder, which stores it until it is excreted down the urethra. The urinary system eliminates nitrogenous wastes from the body. It regulates water balance, electrolyte balance, and the acid-base or pH balance of the blood. The reproductive systems include the male reproductive system and the female reproductive system. The male reproductive system consists of the testes as the organs that produce hormones and sperm, and are supported by the scrotum and it also includes the penis, prostate gland, and the ductus deferens, or vas deferens. The female reproductive system includes the ovaries, which are the primary organ that produces the hormones and is supported by the uterine tubes, as well as the uterus and vagina. And then the secondary sex characteristics are called mammary glands, and they develop in breasts to provide milk. So the overall function of the reproductive system is the production of offspring. Testes produce sperm and the male sex hormone, and the male ducts and glands aid in the delivery of sperm to the female reproductive tract. In the female reproductive tract, ovaries produce eggs and female sex hormones. The remaining female structures serve as sites for fertilization and the development of the fetus, and mammary glands of the female breast produce milk to nourish the newborn. Before moving on to the discussion on homeostasis and anatomic terminology, let's look at some necessary life functions. The first is maintaining boundaries between the internal and external environments. The plasma membranes of cells and the skin found in the integumentary system provide this function. The second function is movement, or contractility. The skeletal muscle will move our body parts, like our skeleton, through space and time. And the cardiac and smooth muscle will move substances through the body, such as blood and materials in the GI tract. Number 3 is responsiveness, which is the ability to sense and respond to stimuli. This is a major component of the nervous system. It also includes reflexes, like the withdrawal reflex if something is painful, and also an involuntary reflex that controls breathing rate. The fourth is digestion, which is the breakdown of ingested foodstuffs, and the absorption of simple molecules into the blood. We have to eat our nutrients. We cannot make our own. There are a few that we can make, but most we have to ingest. The fifth life function is metabolism, which is the chemical reactions that occur in the body cells. They include catabolism and anabolism. In catabolic reactions, substances are broken down into smaller units, such as in digestion. In anabolism, substances are built from smaller units into larger units, such as building muscle and bone during growth and development. Metabolism is largely regulated by hormones secreted by endocrine system glands. The sixth function is excretion, which is the removal of waste from metabolism and digestion. And these waste products include urea, carbon dioxide, and fecal matter. If waste builds up in the body, it can be deadly for the organism. Number 7 is reproduction. This is the cellular division for growth or repair. It is also the production of offspring and is largely regulated by hormones secreted by the endocrine system glands, just like metabolism. And number 8 is growth, which is the increase in the size of a body part or of an organism. Hormones will also largely influence growth. Now let's talk about homeostasis. Homeostasis is the maintenance of a relatively stable internal environment despite continuous outside changes. It is called a dynamic state of equilibrium because the body has to stay within a set range, which is the equilibrium part. However, conditions are constantly changing, and that's the dynamic state. And so the body has to work to maintain a relatively stable internal environment, aka equilibrium, despite continuous outside changes. That's the dynamic part. A disturbance of homeostasis will increase the risk of disease. It will also contribute to changes associated with aging, and it may allow destructive positive feedback mechanisms to take over. For example, heart failure. homeostasis consists of negative feedback and positive feedback. The nervous and endocrine systems work together to maintain balance in the body, and they form a homeostatic feedback loop, which includes the receptor, the control center, and the effector. The receptor is going to sense a stimulus. The stimulus is what produces a change in whatever we're measuring. The receptor then sends that information to the control center, such as the brain. And the brain decides the outcome and sends that information to the effector. The effector carries out the response, such as seen in a muscle or a gland. The most common type of homeostasis is called negative feedback. Negative feedback is a mechanism that reverses a deviation from the set point. It uses the receptor, control center, and effectors to return the body to its ideal set point, bound within the normal range. In this example, temperature is the stimulus. When the body temperature rises, the receptors in the skin receive that information and send it to the control center, which is in the brain. The control center of the brain then decides the course of action to take and sends it to appropriate effectors. In this case, those are sweat glands. So the response to a rise in body temperature will be to sweat, because evaporation of the sweat will cause the body temperature to fall. And that will bring us back into balance. Of course, other things happen in the body as well, other than sweating, but this is a good example. If the stimulus is the dropping in body temperature, once again, receptors in the skin sense the change in the stimulus, the stimulus, which is the change in the variable, and it sends that information to the control center of the brain. The control center of the brain then decides the course of action and sends it to the effectors, which are the skeletal muscles, because they will shiver, and that will cause the body temperature to rise until it returns back to normal. Because as the muscles are shivering, they are releasing heat. This will show the importance of the normal blood glucose levels in the body, which is about 90 milligrams per 100 milliliters. So if after a meal the blood glucose levels rise, that's the stimulus, because that will change the variable from 90 milligrams per 100 milliliters to greater than that. The pancreas has receptors that will receive the information, and they will release the hormone insulin. Insulin will do a couple of things. It will stimulate the glucose uptake by the cells of the body, and it will also stimulate glycogen formation in the liver. And this brings the blood glucose back to normal range. The cells can use the glucose to make energy, and they can store the rest as glycogen. After a while, your blood glucose levels will fall below 90 milligrams per 100 milliliters. So the stimulus is the declining blood glucose level. So the receptors in the pancreas will receive that stimulus, and they will release glucagon. Glucagon is a hormone that will stimulate the release of glycogen from the liver. The glycogen will release glucose molecules into the blood, and that will raise the blood glucose levels back up to 90 milligrams per deciliter, or per 100 milliliters, my apologies. If this system fails, it can lead to the disease diabetes. A less common type of homeostasis is called positive feedback. Positive feedback intensifies a change in the body's physiological condition rather than reversing it. A deviation from the normal range results in more change, moving the system farther away from the normal. This is important in critical situations, such as fever, where the temperature needs to spike to stimulate the immune system, or blood clotting, where platelets need to increase in number to plug a wound, and labor, where contractions need to increase so that the baby can be born. However, if positive feedback is unchecked, it can lead to disease, as mentioned earlier, such as heart disease, because this is how plaque builds up in the blood vessels. This example is of blood clotting. So number 1 shows that there's a break or a tear that occurs in the blood vessel wall. As the blood spills, chemicals are being released that will bring platelets into the area, and the platelets will adhere to the site, and they will also release chemicals. The platelets releasing chemicals will then go to number 3, where it states that they're attracting even more platelets. And so it will loop until enough platelets are brought into the area where the wound is sealed shut and a plug is formed. Again, if this continues to go unchecked, however, one could suffer from clotting disorders. And if a clot forms in blood vessels, we know it's called a thrombosis. And if that thrombosis breaks free, it can cause an embolism somewhere down the line, which can be fatal to the patient. This slide shows the positive feedback for labor. When the baby moves into position and the cervix is pressed on, it sends nerve impulses to the brain. The brain will then stimulate the pituitary gland to secrete the hormone oxytocin. Oxytocin will then stimulate uterine contractions, pushing baby towards the cervix and further dilating the cervix. And it will do this all the way until the baby is able to be birthed through the birth canal. Much of the body's daily energy is devoted to maintaining homeostasis using negative feedback mechanisms. These include temperature, digestion, nutrient absorption and transport, cellular processes, bone turnover, hormone manufacture, neurotransmitter manufacture, the immune response, water balance, ion balance, a whole plethora of processes. Moving on to anatomical terminology. We'll start with the definition of the anatomic position. When assessing a patient, there is a standard anatomical body position that is used, and it consists of the body erect, feet slightly apart at toes and palms facing forward. In these tables, you can see that the drawings are in anatomical position. Anatomical position is useful in defining what's called directional terms, and this helps a clinician to specify the movement in a particular direction on the body. The first two pictured here are superior and inferior. Superior means that the clinician is referring to something towards the head or upper part of a structure above. Inferior refers to something that is away from the head end or toward the lower part of a structure or below. Other terms are ventral and dorsal. Going hand in hand with ventral and dorsal is anterior and posterior. The reason that all four terms relate is because humans stand on two legs. So this doesn't necessarily apply to four-legged animals if you're interested in animal science. Let me further elaborate. Ventral means belly. Dorsal means back. In a human, the ventral belly is anterior. Anterior means toward or at the front of the body, in front of. In a human, the posterior is dorsal because posterior means toward or at the back of the body, behind. So ventral and anterior are synonyms in humans because our belly faces forward. Dorsal is a synonym in humans because our posterior faces back. In a four-legged animal, the head would be anterior because the eyes would face forward, but the belly, which is ventral, would face the ground. In a four-legged animal, the tail would be posterior, but the back, which is dorsal, would face the sky. So again, only in humans are ventral and anterior and dorsal and posterior included together. Other terms include medial, lateral, and intermediate. Medial means toward the midline of the body. Kind of like driving in the road, you have a median, which runs down the center of the road. So it's the midline of the body. Lateral is the side, so it's away from the midline of the body. It's on the outside. Intermediate is between a more medial and a more lateral structure. And you will see the use of intermediate. You'll have a lateral, and you'll have a medial, and then you'll have an intermediate. We'll see this with the muscles and the bones. Proximal and distal are very important terms that oftentimes get confused with superior and inferior. Let me elaborate on the differences. Going back, superior means toward the head end or upper part of a structure of the body, above. Inferior means away from the head end or toward the lower part of a structure of the body, or below. Superior and inferior tend to be best used on the head and trunk. Proximal and distal are best used on the upper and lower limbs. Because proximal's definition is closer to the origin of the body part or the point of attachment of a limb to the body trunk, whereas distal is farther from the origin of a body part or the point of attachment of a trunk or a limb to the body trunk. So let me say this in English. Note that with proximal, I hope you can see my cursor. Proximal will attach at the shoulders and the hips, and that is referring to the upper limbs with the shoulders and the lower limbs with the hips. So the closer we are to the shoulders or hips, the more proximal. Distal is farther away from the shoulders or the hips. So we're moving towards the fingers and the upper limb and the toes for the lower limb. So superior and inferior are better used on the head, neck, and trunk. Proximal and distal are better used on the upper and lower limbs. Superficial and deep. Superficial means towards the surface of the body, like a superficial wound. Deep is away from the body surface and more internal, like a deep wound, a puncture wound. Looking at regional terms, the body is divided into two major divisions, and I kind of just mentioned that to you. We have the head, neck, and trunk, and the upper and lower limbs. So the head, neck, and trunk is referred to as the axial divisions. The upper and lower limbs are referred to as the appendicular divisions. Within these major divisions are a cluster of regional terms which will designate specific areas. And you will focus on these regional terms in the Language of Anatomy lab. Here they are for your introduction. It looks like it's complicated, but it's really not. You know most of these already. So with frontal, that would be your forehead. Orbital, eyes. Nasal, nose. Oral, mouth. Mental, chin. The cervical refers to the neck. The thoracic refers to the chest, and the abdominal refers to the abdomen. Within the thoracic, we see the sternal, which is the breastbone. The mammary, which is also called pectoral, which are the breasts. The axillary, which are the armpits. In the abdominal, there is the umbilical, which is the belly button. Inferior to the umbilical is the pelvic. Inferior to the pelvic is the inguinal or groin. Inferior to the groin is the pubic or genital. So notice that's the axillary division and the regions within. Now let's look at the upper and lower limbs, or the axial or appendicular division. In the upper limb, acromial is the outer shoulder. Brachial is the upper arm. Antecubital is the front of the elbow. Antebrachial is the forearm. Carpal is the wrist. Manus is the entire hand, and it consists of the palmar or palm, pollex, the thumb or digits, which is the index through pinky. On the lower limb, coxal is hip. Distally to the coxal is the femoral or thigh. Patellar is knee. Crural is the leg or lower leg. Fibular or peroneal is the lateral leg. Tarsal is the ankle. Metatarsal connects the tarsus to the digits, and the hallux is the big toe, and the entire foot is the pedal. On the posterior or dorsal side, for the axial, the head or cephalic region consists of the otic, which is the ear. I don't think that was mentioned on the other slide. The occipital, or back of the head. The cervical is still the neck. And then the back, or dorsal, consists of the scapular or shoulder regions, vertebra, which is spinal, and lumbar, which is the lower back. The upper limb consists of the acromial, or outer shoulder, the brachial, which is the arm, olecranon, back of the elbow, antebrachial, forearm, and again the manus with the pollex and the digits, and the carpals and metacarpals. The lower limb consists of the glutes, which then inferiorly lead to the femoral or thigh, the popliteal, back of the knee, sural, calf, again the fibular or peroneal, which is the lateral lower leg, and the pedal or foot includes the calcaneal, which is the heel, and plantar, the bottom of the foot. Between the anus and external genitalia is the perineal. So the perineum is different than the peroneal. The perineum is between the anus and external genitalia. The peroneum includes the branch of the common fibular nerve off of the sciatic nerve, as well as peroneal muscles that move the lower leg and foot. The body needs to be divided into flat surfaces called planes. These cut the body for anatomical study, particularly when taking diagnostic images. There are three major planes considered: the sagittal, mid-sagittal, and parasagittal plane. The sagittal plane divides the body vertically, going down the midline, the medial line of the body, and divides the body into right and left parts. The mid-sagittal lies directly on the midline, and the parasagittal is not directly on the midline. The second major body plane is the frontal or coronal plane, and this one divides the body vertically into anterior and posterior parts. So front and back for a human who stands on two legs. So we could also use ventral and dorsal for the frontal divisions. In the transverse plane, this divides the body horizontally into superior and inferior parts. Generally, this is called a cross-section. So the three main body planes are sagittal, frontal or coronal, and transverse or horizontal. Another division is the oblique section, which cuts the body diagonally. You will see oblique when talking about certain muscles, like the internal and external obliques in the abdomen. This illustration shows the sagittal plane running along the midline of the body. So the mid-sagittal plane is the very specific term for that. And this divides the body into right and left halves. The frontal or coronal plane divides the body into anterior, aka ventral, and posterior, aka dorsal halves. The transverse plane divides the body into superior and inferior halves. At the bottom of this image, you can see three viewpoints. The frontal section is A, B is the transverse section or cross section, and C is the sagittal section. Over 90% of all anatomical structures will match textbook definitions, but nerves or blood vessels may be somewhat out of place, and small muscles and even small bones may be missing. There's a carpal bone that we'll learn about called the pisiform, and that's not in every person. Last, we'll discuss body cavities. The body is pretty much hollow, right? But in order to maintain structure within the hollow body cavity, cavities have to be lined with membranes that help to encase certain organs. So the first body cavity is the dorsal cavity on the back, and it protects the nervous system. The cranial cavity will encase the brain, and the vertebral cavity will encase the spinal cord. Membranes around the dorsal cavity is called meninges. The ventral cavity will house internal organs of the thoracic and abdominopelvic cavities. The thoracic will be your chest, and it will have the heart and lungs. And the abdominopelvic will include the abdominal and pelvic regions, and will include digestive and reproductive organs. Note that the kidneys are not located within the abdominopelvic cavity. They are behind it, or retroperitoneal. The dorsal body cavities are in yellow. Recall that the cranial cavity will encase the brain, and the vertebral cavity will encase the spinal cord. Continuous between the two are the meninges. The ventral body cavity will be divided into the thoracic cavity containing the heart and lungs, and the abdominal cavity containing the digestive viscera, coupled with the pelvic cavity containing the reproductive organs, as well as the urinary bladder and rectum. The kidneys are behind the abdominopelvic cavity. They're posterior to it, retroperitoneal. I keep saying these words, peritoneal. What is that? Well, the membrane that surrounds the abdominal cavity is the perineum, and that's where retroperitoneal comes from, peritoneum. The heart is surrounded by the pericardial cavity, and the pleura is the membranes that surround the lungs. So there are two pleural cavities because there are two lungs. So each pleural cavity houses a lung. The pericardial cavity encloses the heart. The space in between is called the mediastinum, and it contains the pericardial cavity and surrounds other thoracic organs like the trachea and bronchi. The abdominal cavity is surrounded by the peritoneum membrane and contains the stomach, intestines, spleen, and liver. The pelvic cavity contains the urinary bladder, reproductive organs, and rectum. Generally, these are grouped together into the abdominopelvic cavity because they overlap. The muscle that separates the thoracic cavity from the abdominopelvic cavity is the diaphragm. And the diaphragm is one of the major breathing muscles. The peritoneum, the pleura, and the pericardium are all part of the serous membrane family. Serous membranes line the ventral body cavities, and they are thin, double-layered membranes separated by a fluid, the serous fluid. Serous fluid reduces friction as the organs move. The parietal serosa will connect and line the internal body wall. The visceral serosa will be the layer that lines and connects to the internal organ. Looking at this illustration, the pericardium is featured. The parietal pericardium will connect to the body wall of the patient. The visceral pericardium will actually connect to the heart. In between the two layers will be the serous fluid, which will reduce friction as the heart pumps blood. Looking at abdominopelvic quadrants is a convenient way to divide the abdominopelvic region into 4 major subdivisions that can be used by medical personnel to assess injuries or pain. And they include the right upper quadrant, the left upper quadrant, the left lower quadrant, and the right lower quadrant. The abdominopelvic regions are 9 divisions of the abdominopelvic region, which are used by anatomists. They include the umbilical region for the belly. Superior to that is the epigastric region above the belly. Inferior to that is the hypogastric or pubic region below the belly. Centering back on the umbilical region, to the right is the right lumbar, the left lumbar. Looking at the hypogastric or pubic region, to the right of that is the inguinal or iliac region, and the left iliac or inguinal region. Going up to the superior to the epigastric region, to the right hypochondriac region, and then there's the left hypochondriac region. Hypochondriac means under the cartilage, of the ribs. And you can see that corresponding to the illustration with the organs. There are other body cavities as well, such as the oral and digestive cavity. So the GI tract is a hollow tube that extends from mouth to anus. The nasal cavity, which contains your nostrils. The orbital cavities, which contain the eyes. The middle ear cavities, which contain the middle ear bones. And the synovial cavity is found in the joints of the skeleton, which contains synovial fluid and help the skeleton move freely as the muscles contract and pull on the bones. And that is the end of Chapter 1. Thank you for listening.